So let me overview few question with answer. Question number 6. The home healthcare nurse is caring for a male client who is diagnosed with a hiatal hernia and reflex like GERD, which data indicate the medication therapy is effective. So there are 4 options. Which one indicate my patient that taking the medication is working well? So outcome is good. Is the nursing process, like evaluate, assessment, and see the output. So number 1, they said the client take the antacid 1 hour before and 3 hours after the meal. This indicates the client compliance with the dosing regimen for antacid, and not that the medication is effective. Number 1 is not answer because of 2 reasons. Number 1 does not reflect the medication is effective or not effective. It is the basic information about the medication. Even it is wrong information. Antacid always good to take after the food, not before food. Number 2, the client report the indigestion after eating a large meal. So the return of the symptom indicate the medication is not effective because patient have a still indigestion. It does not mean medication effective. Number 3, the client stated that he did not wake up with the heartburn during night time. This is the answer because patient feeling good because of medication. Patient does not feel heartburn, and this indicate the improvement in symptoms and that the medication is effective. Number 4, the client has lost 3 pounds in past 2 weeks. Losing weight would not indicate that the medication for hiatal hernia is effective. Still, patient has a problem. Question number 7, the nurse is preparing to administer esomeprazole. Which intervention should nurse implement? Select all type. So more than 1 is the answer. Number 1, they said order an infusion pump of the client. So when you read this question, examiner does not say the patient need IV therapy. So esomeprazole, the medication name, it is a proton pump inhibitor, is an oral medication. An IV pump is not needed. So number 1 is not an answer. Number 2, elevate the head of the bed. It is the one answer because patient need to take food orally. The head of the bed is elevated for the client to be able to swallow the medication. Number 3, check the client ID with medication administration record. So the nurse must check the medication record with the client ID to make sure the correct client is receiving the medication. So number 3 is the answer as well, right? Number 4, check the allergy to cephalosporin. My medication is the esomeprazole. It is the proton pump inhibitor, not a cephalosporin, not a penicillin. The cephalosporin are a class of antibiotics, not related to this question. And number 5, ask the client his or her date of birth. It is the answer as well, right? Why? The Joint Commission require that the patient identification is used to determine the right patient, right? And also most of the healthcare facilities or provider use the client name and date of birth as the identification. What next? The nurse is discharged a client diagnosed with GERD, gastroesophageal disorder, right? So which information should the nurse include the teaching? So out of all, which is the correct answer? The patient who have a GERD, retrograde direction. So number 1, there are no complication of GERD as long as you take the medication. So nobody can say that the medication 100% will be okay. H2 blocker actually block the production of gastric acid and have a longer effect than antacid. So I said there are no way we can tell that the patient do not have any complaint after take this medication. Let me recap it. As I told you, there may be several complications of GERD. Adult onset asthma or Barrett esophagus leading to the cancer of esophagus are 2 complications of GERD. The chance of developing this problem is less if GERD is adequately treated, but there is no guarantee. So number 1 is not a answer. Number 2, notify healthcare provider if the medication does not resolve the problem. It is the answer because the client should always be informed of what symptoms are reported to the healthcare provider. So we have to include it to the patient education. Number 3, the immediately after a meal, lie down for 45 minutes. The client should be instructed to sit upright at least for 60 minutes, forwarding a meal to prevent the reflex gastric distress or ulcer. So number 3 is not a choice. And 4, say if any discomfort you feel, it noted ask the NSAID for pain medication. So it is dangerous because NSAID can increase the gastric distress. Ulcer caused by NSAID. So NSAID use may be asymptomatic or symptoms may be attributed to the GERD. The client should use the prescribed H2 blocker or proton pump inhibitor and an antacid to relieve the discomfort associated with GERD. If patient need NSAID, they should talk to the their doctor first. Question number 9. Here, the nurse is discharged a client 2 days post-operative after hiatal hernia repair. Which discharge instruction should the nurse include? Select all. So first one, take all of the prescribed antibiotics. It makes sense. Patients sometimes do not take antibiotics because after 1 or 2, 3 days, they feel good and they stop the medication. Eat 6 frequent small meal. It is good for them. Or use legs to bend down, not to back, because patient just came after repair of hiatus hernia. So number 1, prescribed antibiotics. Keep in mind, prophylactic antibiotics are frequently prescribed both pre-surgical or post-surgical patient. The client should be instructed to take all medication as directed. I said the client should be instructed to take all medication as prescribed. Number 2, we said 6 small meal. Hiatus hernia repair may not last the end. The client should continue the recommended lifestyle modification, such as eating small, frequent meal. Number 3, use the leg to bend down. So part of the lifestyle modification for hiatal hernia is to limit the pressure on abdominal cavity, especially after a meal. Using the leg muscle to bend down rather than bending over, and should be taught to your client, teach your client. Take esomeprazole twice a day. Esomeprazole is administered daily, not twice a day. And use the pain medication when pain is 8 out of 10. So for the best relief, the pain medication should be taken at onset of the pain. The client should not wait until the pain is 8 out of 10, right? They should take the medication before the pain goes that level. Next question here. The adult client recently has been diagnosed with asthma. Which medication is recommended to treat this problem? Number 1, omeprazole. Number 2, amoxicillin. Number 3, loratadine. And number 4, steroid or prednisone. Answer is number 1. Why? Omeprazole, it is the proton pump inhibitor. Keep note, up to 90% of adult onset of bronchial asthma is the result of GERD. So treating the gastric reflex will treat with the asthma. Let me recap it. Asthma patient also have a GERD. So we have to take care of the GERD by omeprazole. And the first line of asthma medication is the short-acting beta agonist. It is called albuterol, salmeterol, long-acting, then we can give them steroid. But let me recap it. Up to 90% of adult onset asthma is the result of GERD. So treating the gastric reflex will treat the asthma too. So our answer will be omeprazole. Amoxicillin. It is a penicillin derivatives antibiotics. The client is diagnosed with asthma, is not an infection. There is no reason to administer the antibiotics. Now, Loratadine, it is the antihistamine. Antihistamines such as clarithrine are used to treat allergic reaction to the pollen, dust, or other irritating substance. They are not effective against the asthma, right? And as I told you, the prednisolone is the glucocorticoids. Glucocorticoids are prescribed daily for the client with chronic lungs disease, such as emphysema or chronic bronchitis. A client with asthma would not be prescribed daily steroid.